my anesthesia rotation, I was still in the OR, and I was doing procedures. I was intubating patients. They were letting me start IVs. But also, like, once you get back and everything's settled on after you induce a patient, you're looking at their vital signs, their heart rate, their blood pressure, and at the drop of a hat, if something goes wrong, like, the surgical team, they're looking at you.
Everybody's
like,
looking at anesthesia.
Like, you got to fix this. Like, fix the blood pressure, fix this. And like, you're racing around, grabbing meds, pushing, flushing meds in. So, and I was like, wow, I like that, kind of get to sit back, watch everything, but at a drop of a hat, you have to be fast paced and moving, ready to go. So I feel like that was kind of the delineation for me. And then as I was going through third year and talking to classmates, like, there were some classmates who were interested in surgery, and they were like, if I just stand in the surgery for 6.5, 7 hours and I just do nothing but retract, but at the very end, they let me make this tiny little closure, then it was worth it for me. And I was like, that is not worth it for me. Like, I could have ate lunch, I could have sat down just to like close this like little, incision. Like, that's just not worth it for me personally. So I was like, okay, there's clearly a difference between the people who like want to do surgery and the people who don't.
Welcome to Mission to Medicine. My name is Akeem Henry. Today we have another special guest on the channel. Today we have Cameran Burt. He's one of the original founding members of Mission to Medicine. We made a video several years ago in our college dorm, and since then I've been getting questions about where has Cameran been, because he hasn't been on the channel since then. But that's because ultimately I kind of took over the channel, but he's been behind the scenes, still doing his thing, still pushing along their journey. So today we have him back on the podcast, on this channel, so he can share with you where he's at in his journey and where he's been. And you know what? Back then he was Cameran Burt, but he's no longer Cameran Burt. Today he's Dr. Burt. So Dr. Burt, welcome to Mission to Medicine.
Thank you. It's definitely been a long road since the days back in the college dorm, but glad to be here and kind of give an update and say how things been going.
Yeah. So tell me a little bit of background about where you're from, what undergrad did you attend? Because, some people weren't around back then. So this is their new introduction to you.
Yeah, absolutely. So Akeem and I actually first met in high school. We both attended high school in Baltimore. And then I think it was around like senior year sometime, like probably like in the spring. I remember like I'd like mentioned that I was going to UMD, and he's like, "Oh, no way, I'm going to UMD too." And it just kind of like happened like that.
That was like in a cafe.
Yeah.
I remember the cafeteria.
Right. And then we were privileged enough to both be going to UMD. I also knew that he was pre-med as well. So I knew I'd have somebody to go along the journey with at University of Maryland, be able to navigate kind of the pre-med journey together. So we both went to University of Maryland, where we were both pre-med. I was a biology major. It was a long road, a lot of studying, a lot of hours put in. That we were studying in the library, trying to find different spots on campus to study, but we were in it together, kind of pushing through. So gratefully, I graduated from University of Maryland and then went on to med school at University of Maryland School of Medicine. After taking one gap year where I did some research, went on to med school at University of Maryland School of Medicine. And then somewhere along in my med school journey, realized that I wanted to specialize in anesthesiology. And I was fortunate enough in March of last year to match into anesthesiology and got to stay in Baltimore to do that. So excited to be here.
Perfect. See, y'all got the high level overview. So we're going to dive a little bit deeper into your story, get a little bit more nuance into the different details that makes that journey so sweet. So Cameran, when did you know that you wanted to become a doctor?
Wow. I think for me, it was probably sometime in middle school where I thought that I wanted to be a doctor. I was really always like into science. Mm-hmm. I really loved my biology classes, but at the same time, I still had some other interests. I was thinking maybe I would go become like a lawyer. I was really into sports. I was like, oh, maybe I could be like a sports agent or something like that. But I remember for me, I heard about the story of Dr. Myron Roll, who's actually a neurosurgeon now, and he played football and ultimately went to medical school and went to neurosurgery residency. But his story really resonated with me. He was someone who was very like academically inclined, also like loved science. He was into sports as well, which was an interest of mine at the time. And just hearing him talk about the opportunity to become a doctor in a leadership role and being able to heal people and make a positive impact in that way really resonated with me. And I decided, I think that would be a great field for me as well to decide to go into medicine. So from there, I pretty much never looked back. I remember like freshman year of high school biology, loving it. And I was like, oh man, this is going to be a great foundation for, further biology classes and ultimately going into medicine. So from that time in like middle school and early high school, I really never looked back once I decided to become a doctor.
Mm. And so from that time when you graduated high school, having that, minor role and those type of people that you looked up to, when you finally got to college, what was your experience like being pre-med?
Yeah, college was tough. It was a lot of work. I think that I had a good foundation from high school. Both of us were fortunate enough to attend a college prep high school where we were used to putting in hours studying and taking difficult and challenging classes. But college was definitely a whole nother level, particularly classes like chemistry, like organic chemistry, orgo, some of the biology classes, biochemistry, which was to me like one of the classes I had to study for more than any other class. So it was definitely challenging, a lot of time put in. But for me, it was just, I realized that I really had to fall in love with the process and not get so focused on the end goal. Like, I just need to get through this because I want to be a doctor and I just got to pass these classes. It's like, no, I remember me and King, like we fell in love with like orgo and like, okay, I really want to understand like how this works and, writing things out on the board and really trying to dive deep into it. And I feel like that's what really helped me get through that journey, was really trying to master each subject that, I was taking at the time instead of just solely focus on the end goal. So I think that was like really, really key. And then of course, we got involved in extracurricular activities, which I think was really
co-presidents of the pre-med society,
right.
Larger pre-med society.
Yeah, exactly. I think that was just a great opportunity to meet other like-minded people who were also pursuing medicine, people who could also encourage us along the journey, as well as just to have an outlet outside of just like being in the books and just like studying. We got opportunities to get clinical experiences, got opportunities to visit medical schools, anatomy labs, as well as just meet physicians, just hear their journeys and get advice from them. So I feel like that was a great experience, as well as other things we got involved in. Like we were both RAs in college, and other things we were involved in. So overall, I would say my college, it was a lot of work, but it was a good experience.
Mm-hmm. I definitely felt like we were very involved in the trenches, like able to grind, able to study, but also balance it with extracurriculars, being out there, being able to network, going to other institutions, like you said, to meet people in the field. But we all know being involved in that capacity, sometimes it can be stressful with balancing academics. So how were you able to balance all the extracurricular, all the things while being, an undergraduate student and then potentially also studying for the MCAT too during that time? Yeah,
it was honestly a lot. And to be honest, so my freshman year, I felt like outside of school, I really wasn't involved in too much. I was like making that transition into college. I would attend different, meetings or things like that, but it was more so just as a member. So not really much of a commitment on my end. And sophomore year was the first time we actually started getting involved. Sophomore year, I was an RA, which requires you to be on duty certain nights of the week. So you have to round the building, and if there's any incidents, you have to respond to those. I was also on the executive board of our pre-med organization, as well as balancing just being a student. And for me, sophomore year was probably my most challenging year because trying to make that transition, I felt like my time management wasn't that great between studying as well as handling all these other responsibilities. So I feel like my academic performance wasn't up to what I felt like it could be. So sophomore year, I definitely struggled a little bit just trying to find that balance. I feel like I was wasting a lot of time just sitting around, just kind of hanging out. But it's like when you have all these other extracurricular responsibilities, you really have to manage your time. Downtime, you should either be studying or doing something else. Your time needs to be planned out. And the time that's going to be just downtime chilling, that needs to be planned out, knowing that you put in the work or you're going to put in the work later. So I feel like it was junior year where I feel like that was really the first time I was able to do a good job balancing being a student as well as all the other extracurricular activities. So it's something that takes time. You have to feel it out and see what works for you. But I feel like mastering the time management is really crucial to being successful, not only in academics, as well as your extracurriculars, but also feeling like you have a life outside of those things as well.
Mm-hmm, absolutely. Time management is key, definitely in undergrad, because it prepares you for med school because it gets worse. But in regards to how you prepared and for the application, preparing your application for med school, what was it like studying for the MCAT?
Yeah, absolutely. MCAT's a beast. That's the first, for me at least, the first really big exam that I was preparing for. In high school, you have the SAT, but the SAT, you don't study for that nearly, at least most people I talk to don't study for that nearly as much as the MCAT. So for me, I knew that I would have to really space it out and create a study plan that would be reasonable.
Mm-hmm.
So I felt like, just only studying during a semester and taking at the end of that semester, I didn't feel like that would be enough time for me. So for me, what I did was, I think it was the fall of senior year was when I was like, okay, I'm gonna try to work in my studying on top of my coursework. So maybe like a couple of nights a week or so, like from probably starting in like September or October of that fall semester, I would go through. I had exam crackers books. I was going through the exam crackers books, doing questions, reading, and just trying to remember some of the content that I learned from some of my previous pre-med coursework. And then I knew that I would need like a dedicated period to study for the MCAT where that was the only thing I was doing. I wasn't doing school, extracurriculars, anything like that. So that was my winter break. So my winter break was hardcore library every single day, maybe like one day that I took is like a half day or so, like on Sundays. And that was like probably like a 3.5 or so week period of just purely studying for the MCAT, doing practice exams multiple times a week, doing questions every day. And that was challenging. I feel like it's always hard. Anytime you go through a period where you feel like I'm putting in the work and you don't see the results, that's some of the most like trying times I feel like of this entire like medical journey.
Yeah.
Because you feel like
I've been there.
Yeah, like it's for me, like that's so hard. Like I'm putting in the work. I'm waking up early. I was waking up probably like 5 a.m. or something, 4:30, something like that. So I could, go to the gym and then study. I was on the grind every single day, missing out on like, family or friend events because I was studying. And initially I was not seeing that improvement. And it was so frustrating, but I was like, you know what, just stay committed, keep putting in the work. And that you're trying, you're doing your best. And, I was seeing little improvements and eventually it started to go up and I was like, okay, now I feel like I'm in a good spot. So it was kind of slow at first. And then from there, I feel like that's when I started making jumps.
And you were using the AAMC practice full-length exams. You're using different practice resources. Those were you were saying you're seeing something slowly go up. Those practice scores, right? Exactly.
So I think it was daily. I was doing exam crackers. I think there was like a Q bank from AAMC that was like trying to line up with whatever coursework I was studying that day. So if it was like the biology section or the chemistry section, trying to line it up like that and create like a bio day or like a chemistry day or whatever, a cars day. And then I feel like I used some third party for the exams earlier on, but then once I started doing the AAMC exams, that's when I really started to see the improvement that I wanted to see. So for me personally, my resources were exam crackers books for my content. I was doing I think it was one of the Q banks or the Q bank, I forget what it's called, but some question bank that the AAMC has. And then some like third party.
Yeah, they call them the Q packs.
The question packs. Those are called question packs. Some third party practice exams, and then mainly the AAMC exams to really give a feel for like what your score is going to be closer to exam day.
Mm-hmm. So with that being said, once you get that MCAT score that you worked so hard for and prepared for, as you described, it's really about finalizing the application package and submitting it off to med school. I know you had mentioned that you took a gap year. So can you talk about that process of what you did during that gap year? How did you use that gap year to kind of get you more in line for that acceptance in med school?
Yeah, absolutely. I think I decided to take a gap year probably, I think it was around like my sophomore year of college. And for me, my reasoning was I felt like it would be valuable to get at least a little bit of life experience before matriculating into medical school. Just for me, I felt like the college environment, it was a great environment, met a lot of friends and had a lot of great experiences, which we talked about. But I feel like college is very much a bubble. You're surrounded by 18 to 23-year-old students who are all college students and, studying for exams. And like everyone in that environment, for the most part, their biggest worry is their next exam that they have, right? But like when you get into the real world, like people have bills to pay, people have other things. And especially talking about medicine, people have illnesses that affects their life in so many different ways. So I just feel like it'd be valuable to get that experience. So I knew pretty early on that I wanted to do that. And then for me, a lot of deciding like what my gap year would look like was more so like I knew that I wanted to stay at home with my parents to save money. So that way it would give me some flexibility in terms of what I would do in my gap year where money wasn't as big of a concern. So I ultimately decided to take a research position, doing clinical research at a outpatient orthopedic facility. And I felt like it was a good experience in terms of one, diving into a skill that I really hadn't had much experience with, being clinical research, which was valuable and has helped me down the line, as well as gave me clinical exposure, interacting with patients, and it got me very comfortable. Like when you have to go up to a patient, like it was in the first thing in the morning, right before they're about to have surgery, I had to ask them if they would enroll in some research study. I feel perfectly comfortable like going in and just like talking to a patient now clinically about, asking questions or doing an H&P and things like that, just because from that experience. So I feel like that was another valuable thing, as well as just talking to patients and hearing how whatever injury they had is affecting their quality of life, whether it be work or not being able to do the hobbies that they enjoy. And it really gave me some broader scope in that respect as well. So I felt like that was a really great experience. And then you kind of touched on a little bit, but in terms of how I prepare for the application process, I can dive into that a little bit as well. One piece of advice that I got pretty early on in the pre-med journey was to start like keeping little some type of documentation of some of your experiences that you're having that you may want to talk about, whether it be extracurriculars, clinical experience, research experience, and try to like jot down some like highlights of those things. So that way, when it's time for you to put that onto paper in the application process, you're on top of it and you can apply early because you've already kind of thought about these things and how it will translate into medicine and really reflected on it. So I would like keep like a little document where I would keep the experience, what the contact, who the contact person is, and like their email address, because that's something else that you have to put on the AAMC application. But all those things were just to optimize myself so that way I could apply as early as possible, because that's a huge predictor, honestly, of getting in a lot of places, is just putting yourself in a position where your application is getting looked at sooner. Whereas later in the process, there's not as many spots available and it's a little tougher. So it was, generally speaking, those are some of the ways I prepared for the application process.
Would you do a gap year again?
Absolutely. I think that it was a great experience for the reasons that I said. It also just spaced out the process. There's so many things I think that you want to tap into in order to make yourself a competitive applicant. Everyone has their own passions, which you want to dive into. And it's like, if you have, if you decide you want to go straight in from med school, you really only have like 3 years of college to exemplify what kind of student you are and what type of leader you are on campus and the things that you've done. And the other thing for me was I felt like academically, it allowed me to show a greater like positive progression, because my senior year grades were my best grades of college. And I feel like that was partially because I had mastered my time management, my study skills. So that was also put me in a good spot, because I had the strongest senior year, show that really strong positive progression of my academics as well.
What age did you ended up matriculating to med school?
So I graduated college when I was 22. I took one gap year, so I matriculated when I was 23 is when I started med school.
Okay, not too bad. I was going to ask you if you felt like your age impacted your mindset, like, oh, am I going to fit in? No,
I feel like most people were around that age. I feel like I was kind of like, although I was still generally speaking like pretty young. We had some people like closer to 30 in my med school class. I don't think in my personal class we had people much older than 30, but I definitely feel like there was, I feel like a little bit of some people says, I don't know if I felt as much, but I think the people who came straight in, some people were like, oh, like I could kind of tell. Whereas like they felt like the people who were like had taken a year or so had maybe had like a little bit more like life experience and I don't know, not necessarily maturity, but just like more perspective, I guess.
More perspective on life. That's
so.
True.
I mean, the people who I had a lot of great classmates who went straight in. I feel like they were all really intelligent and made great doctors. So at the end of the day, I feel like you just have to really do what you think works best for you.
Mm-hmm. Taking a gap year is considered a non-traditional route to med school. I have a lot of listeners and viewers who are on that non-traditional route, maybe career changers or people who are just, in that loop where they're stuck, studying for the MCAT, getting their GPAs up, might have to be considering a post-bac. Taking a gap year and taking years off from school, life, like you said, comes at you. You have bills to pay. Things come in the way that might distract you and derail you from your goal of ultimately becoming a physician and getting into med school. How did you stay disciplined? How were you able to stay motivated through your gap year when life threw its things at you?
Yeah, absolutely. I think for me, I think one of the most crucial or pivotal moments in my like entire pre-med journey was the opportunity I had, or that we both had actually, to attend the SMDP program at Duke University, and that was the summer between freshman year of college and sophomore year of college. And I feel like for me, the reason why it was so pivotal is because, you know, I'd always said, like I said, from middle school, early high school, I knew that I wanted to become a doctor, and it was kind of like a dream and something I was working towards. But for me, that was the first time where I actually met people who were medical students, like one-on-one, to be able to talk to them, not only just like to just like briefly in passing talk to them, but really like understand like their journey, their story, hang out with them. So this program, it was a 6-week program we did at Duke University that was also hosted at many other medical schools throughout the country. It was an intensive program where we were taking pre-med coursework. We were doing like writing classes with Shirley. Shout out to Miss Shirley.
Who are you? That's the infamous.
That's how she would start off the class. Like, who are you? And we'd be like, I'm Cameron, I'm Akeem. She's like, no, who are you? And she wanted you like to tell like what makes you up or something. But shout out to her. But yeah, but that was the first time that I actually had to experience like interacting with medical students. And I remember some of our TAs and RAs that we had, not only were they medical students and could talk to us about that, but they were also just like down to earth people. They would watch basketball with us. We'd play sports, we'd hang out with them, and just have a good time. And not only like were they medical students, but also they were medical students that looked like us. They were medical students of color. So I feel like they related to us on other aspects as well. And I feel like that was really pivotal. So for me, like having seen them do it, I was like, okay, like, and I had, from that point, I feel like I had in my head, like, you're going to be a doctor. Like you put in the work, like you've seen it's possible. You've seen that you can do it. So I think that it's really important to just, you know, tap into some type of network or someone that you can look up to who can give you advice and show you that it's possible, you know, whether that be, you know, someone online that you've met or seen, or if you get the opportunity to go to your local medical school and interact with someone, I would highly recommend doing that if they have some type of open house, just to meet somebody and say, you know, for you to say, okay, I see them doing it. This is actually possible and I can do it. And also, like, I think that it's important to get like real, honest advice throughout the process in terms of being honest about what your weaknesses are. You know, if your weakness is the MCAT, getting honest advice about, okay, how can I really jump my MCAT score? If your weakness is your GPA or whatever else it may be, you want someone who's going to be honest with you. So finding some type of pre-med advisor at your university or whatever, you know, wherever you're at, to really give you honest feedback and advice and acknowledge your weakness and really attack whatever your weakness is. Because it's not going to, you know, just ignoring it is going to take away the fact that it's there. So that's what I would say.
Ultimately, it sounds like the pre-med experiences that you had helped shape your drive, and also having mentors and having those clinical experiences kind of increase your resolve when it got difficult during the gap years. And definitely, y'all, if you're pre-med or pre-health, please look into the SHPEP program. SMDP is what it used to be called back then in 2015 when we went to the program, but now it's called SHPEP. So definitely go and check them out, because that could definitely help a lot with getting more clinical and research experience. So with that being said, that transition going from your gap year to medical school, what was that like? Because you're not doing any academics during this gap year. You're working as a researcher. What was it like getting back into the swing of things as a first-year medical student?
Yeah. For me personally, I felt like the transition was tough, to be honest. Like it was a hard transition. I feel like for me in college, like one of my main study methods, it's like if you would walk into a room where like me and Akeem were studying, and as well as the group of people we were studying with, there would be stuff written all over the whiteboards. We'd have papers. We used to get like white pieces of paper, just like have like keep writing things out. And I just felt like in medical school, with the volume of information, for me, I just felt like that would not be efficient. So I had to like figure that out. So I started dabbling with Anki, and I feel like whatever way I was like making my Anki cards the first time leading up to my first exam, I feel like it just was not an effective way. My Anki cards just weren't good. And it's like with Anki, it's like if you're making your cards, at least whatever you make, like if you put junk in, you're going to get junk out. So, and I feel like that was me for the first test. Like,
you're better than a lot of some med students because making their own cards, that's a beast right there. I do pre-made decks.
Yeah.
Sometimes I make my own cards, but making your own cards for every single lecture, that's dedication right there.
Yeah. I just feel like for me, like, particularly because I wanted it tailored to like our lectures and our coursework. That's why I did that. But so all that to say, my first exam was very bad. My anatomy exam, it was like a practical. I feel like I did not realize the level of detail that we really needed to know our anatomy. So first exam was a wake up call, and then I think from there, I figured out, okay, like I talked to some of the upperclassmen who were above me, and they talked about how they made their Anki cards, how they studied for the lab practical. And I feel like then I started to get settled in. And then particularly, like once we got to content that was kind of similar to the type of content we did during undergrad, like your biology or biochemistry, that's when I really, really started to settle in and kind of get a feel, get my feet wet and get more comfortable.
In regards to how you stayed motivated through med school, I know you had mentioned during your gap year, you referenced SMDAP, your clinical experiences. But once you get into med school, you're studying almost every single day. Like it's a grind. Like it's to take a day off. You're behind. Like they talk about the pancakes, right? So how did you stay on top of it so that you didn't get behind? I mean, how did you stay on top of it so you didn't get behind and burn out?
First of all, I feel like it's impossible to not get behind. For me, like that's what even like I would talk to someone like who I saw as like the smartest people and like some of the upperclassmen, and even they would be like, "Look, like I'm not Superman. Like I can't stay on top of this either." And I feel like that made it like real for me. I was like, okay, like if even that person is saying like there's no way to stay on top of it and like not get behind at all, like then okay, I was like, all right, I have to give myself a little bit of grace. But like
grace is real, y'all. Give yourself grace.
That's important. But I mean, it's just like you have to stay on it like every single day, like to be making like positive momentum and like keep pushing through the material, or else you'll fall behind. It's just unreasonable. So, I feel like a big thing is just like being surrounded by people who are also going through it. For me personally, I studied in the library, and it's like I'm not a group study type of person, but just seeing other people who were there who like got to the library right after class got out and they're there, into the evening, like knowing that other people are doing it, I feel like it's okay. Like if other people are doing it, like we're all in this together, we're going to get through it. So I feel like that was a big thing, just having like a community of people. Also when like, things get tough, like having other people just like talk about it with. So my schedule in med school was we had lecture for, I think it was the first year was like 8 to 10, and then second year shifted to 10 to 12. I personally did not attend lecture. I would watch the videos like sped up from like the day. So like in the afternoon, I would watch the lectures that actually were live the morning of. And then I would do my Anki in the morning, and then I would watch the lectures in the afternoon. So I would, in the morning, do Anki from like 12 to 1. I would meet up with one of my friends, and basically we would just like eat lunch, catch up. We would complain about like this lecture, like this was hard, or like, man, like how are we going to get through this? And then by like 1 o'clock, it's like, all right, like we got to go upstairs and like put in this work now. Mm-hmm. So then we did that. And like for me, I think it was like 1 to 5 is when I would like watch the lectures, make cards. And then from like 5 to usually like 7:30 was like my break time. Back before the pandemic, I would catch the bus to and from campus. And that's time I would use to do Anki. And then when I got home, I would eat dinner, kind of chill for a little bit. And then like 7:30 or so, get back to it. And then probably until like 9:30, I would study and then like wake up and do it all over again. So that was like generally my schedule. So
the grind. You had mentioned when you entered med school, you were using Anki, and I guess you group studied as well. And so that's pretty much your preclinical years. You kind of kept that pattern, right?
Yeah.
Okay.
For the most part.
So when you got to clinicals, I know you got to, what were all the specialties that you were able to rotate through?
Yeah. So
you don't have to say all of them if you don't remember every single one.
No, I mean, I remember. I still remember my schedule. So I started off on neurology. I did peds. I did OB. In my year, was the first year that we had a required anesthesia rotation for 2 weeks as part of our OB rotation. So I'm sure we'll probably touch on that later. But OB anesthesia, I did psych, internal medicine, surgery, and I think that was it. Yeah, I think that was all of them. And family medicine was the other one.
Okay. So what specialty did you enter med school thinking you would do?
So I entered medical school thinking I was going to do a surgical specialty. I had some shadowing experience prior to medical school in the operating room, and I love the operating room environment. I love the team environment. I love being hands-on. So I was thinking I was going to do surgery, but that definitely shifted in med school.
What led to that shift?
Yeah, so I think for me, like, I feel like the seeds first started to be like planted sometime in like first or second year when I was like, so at that time, again, I was still thinking surgery, but I was realizing that I really liked physiology way more than like anatomy. And I like thinking about how the whole body worked as a whole, thinking about cardiovascular, thinking about pulmonary, and all those different things as opposed to just like anatomy. But I feel like I tried to force myself to like tell myself like, oh, like, you know, anatomy is like great and you really like it and whatnot. But that wasn't really the case. So that was the first time I started to think about that. And then once I actually got to my rotations during med school, I was like, I don't think surgery's for me.
So you had mentioned that during that year that was like the first year that y'all had a mandatory anesthesia OB rotation.
Yeah.
So what was that experience like, and what kind of shaped you to ultimately decide anesthesia was best for you? Yeah.
So for that rotation, it was so OB was like a 2-month rotation as a whole. It was 8 weeks. We did, and it was split up into 4 2-week rotations. So we did 2 weeks on labor and delivery, 2 weeks on gyne surgery. The place I rotated at, we did 2 weeks on breast surgery, and then we had 2 weeks of anesthesia. And I feel like for me, it was perfect in terms of figuring out. So at a certain point, I was like, okay, like I know, I think it was like towards the end of like second year, I was like, okay, I know that I want to be in the OR. So that leaves you only at anesthesia or surgery. And I pretty much had, I had my breast surgery rotation back to back with my anesthesia, or gyne surgery back to back with anesthesia, something like that. And I was fortunate enough to be at a place rotated. It was at a community hospital, and the breast surgeon, she didn't have any residents for the most part. So you were like right there one-on-one with her, scrubbed in. Like she would let you do a ton of stuff. Even when I was on gyne surgery, I was one-on-one with the attending. And they would like, for example, I think we did a salpingectomy, removing, salpingectomy. So we were removing like fallopian tubes. And like the attending surgeon did one side and I did the other side. And he would just be like, okay, you show me how to do it. He's like, okay, now I'm gonna show you how to do it. He's like, just take your time, be slow, be careful. And I'll let you do it as long as you're safe and like careful. I was like, wow, this is like really, really cool. But I feel like I didn't appreciate as much like focusing on one specific part of the body, dissecting out these like little structures and suturing things up. As much as when I got to do my anesthesia rotation, I was still in the OR, but I was doing procedures. I was intubating patients. They were letting me start IVs. But also like once you get back and everything's settled on after you induce a patient, you're looking at their vital signs, their heart rate, their blood pressure. And at the drop of a hat, if something goes wrong, like the surgical team, they're looking at you.
Everybody's looking at anesthesia.
Like, you got to fix this. Fix the blood pressure, fix this. And like you're racing around, grabbing meds, pushing, flushing meds in. And I was like, wow, I like that, kind of get to sit back, watch everything, but at a drop of a hat, you have to be fast paced and move and ready to go. So I feel like that was kind of the delineation for me. And then as I was going through third year and talking to classmates, like there were some classmates who were interested in surgery, and they were like, if I just stand in a surgery for 6.5, 7 hours and I just do nothing but retract, but at the very end, they let me make this tiny little closure, then it was worth it for me. And I was like, that is not worth it for me. Like I could have ate lunch. I could have sat down just to like close this like little, incision. Like that's just not worth it for me personally. So I was like, okay, there's clearly a difference between the people who like want to do surgery and the people who don't. And I feel like I did not fall in that category of people who were like really, really passionate about surgery. So I was like, I knew anesthesia was it for me.
That last statement definitely brought it into perspective.
Yeah.
So that's interesting. I'm going to take this moment to be a little bit selfish right now, being that I'll be soon be going to clinical rotations. What advice do you have for current medical students who are going on rotations, what to expect, what to do when going through these different specialties?
Yeah, I feel like clinical rotations is definitely something different to navigate because, up until that point from your even high school and medical school or college and medical school, you're used to, watching a lecture or going to class, studying for it, and then taking an exam, and that's your performance.
Mm-hmm.
But I feel like third year is not only just your book knowledge, but also your social skills and how you're able to navigate interacting with patients, interacting with your the residents and attendings, the nurses. So you kind of have to navigate that as well. And also, it's like your presentation skills and trying to develop some confidence with that. So I feel like it's a lot to navigate, and it can be a little overwhelming at first. I think the biggest thing, there's like a few like major tips I would say. One is like if you're like, they call it like following a patient. If it's a patient that you're going to be presenting on and you're going to be seeing in the morning and things like that, you need to treat that like that is your patient, and like you want to know as much as you can about what's going on. And like you're not going to know everything. Like let's be realistic. Like you just came off of your first 2 years of med school. Like you're not going to know as much as the resident who's already gone through medical school and has seen many patients before. But ask questions, look things up, and try to understand as much as possible and understand like why things are being done. I feel like in third year, it's really easy to just regurgitate like whatever the attending says or whatever the residents say. Mm-hmm. But it's like, do you actually understand why we're giving that treatment, or do you understand why we're doing this test? And I feel like that's the point where you really start to develop a strong understanding. So that's a big thing. I feel like another thing in terms of, just like your bedside manner, that's really important. And also just like, I feel like you gain a lot of information by just like spending time talking to the patient and actually understanding their story. Sometimes you're able to offer information that, someone else from the team may not have known just because they weren't able to spend that amount of time. And as med students, out of everyone on the team, you pretty much have the most time to be able to spend time and talk to the patient and gain something that may be valuable down the line. It could be like, something at home that may affect their, discharge or whatever it may be. So I think it's important to understand those things. I think another piece of advice is like to not get too comfortable to think that you're on the same level as residents. I feel like I've been on rotations with people and they've gotten too comfortable and like, I don't know, like they're still like a resident is still, a little bit above you in terms of, they're kind of guiding your education a little bit on the clinical rotations. So, if they ask you or they offer to teach you something, like say yes. I remember as a resident, had an experience before where there was, students who, a resident may offer to teach something like, nah, I'm good. I'm just like, you don't like pass on the opportunity. Resident just offered to teach you something, like you should take that opportunity.
Right.
Or sometimes people get a little too comfortable, I think, and start like making jokes or like making comments about patients, and like they kind of lost some of that like professionalism. And that's another like big no, like not to do. So that's another thing I would say. And then I think it's important, last piece of advice I'll say is it's important to get feedback from your senior resident or whoever is kind of like, on your team, to say, hey, like, how are my presentations? Like when you're on medicine, you have to give a presentation. Okay, this is the one-liner of why the patient's here, what's going on. And this is their data. This is what their labs look like. This is what their vitals look like, things like that. So it's important to get feedback. And so that you can give an honest, like evaluation of how you're doing. Cause it can be very easy to go through it and you're like, oh, like I'm doing good. And then like you get your evaluation and it's like they can have improved here or there. So important to get good feedback as well.
No, that's solid advice. Appreciate that. I'm definitely going to keep some of those keys that you just mentioned there. Keep that in mind in the spring. Did you have any mentors in med school?
Yeah, definitely.
Okay. Yeah. So what was that like, building those relationships? How did you foster those mentee-mentor relationships? Because right now I'm kind of struggling with kind of figuring out the best way to continue building that naturally and organically without seeming forced.
Yeah. I mean, honestly, I think the best way, if you're lucky enough to meet a mentor like this, is if you happen to rotate with somebody, and you really like them, you think they're a good doctor, you think they're a good person, that might be someone who could offer you some advice in terms of your journey. That's the best way, I think, because it just happens organically. You work with them, you have something to relate on, you could talk about, and kind of develop the relationship from there. But, you may not be fortunate enough to have that experience where you rotate with somebody that you see as potentially becoming a mentor. So I personally feel like if you're able to, send an email to somebody or get a hold of somebody, it's like, hey, like I'm interested in your specialty, and someone who's like willing and receptive to having mentees. It's like, hey, I'm really interested in your specialty. I'd love the opportunity to meet or discuss things. And at the end of the day, like doctors are very busy. So sometimes they might not respond to your email like right away. Mm-hmm. So I would say give it an appropriate amount of time. Like, if they don't respond after a week or so, then say, hey, like, just reaching back out again, still interested. And, and don't feel like shy about that. Like, I wouldn't say like double email them like within like a couple of days, but like if it's been like a week, 10 days and they still haven't responded, send them another email response. And if like, obviously if they're not getting back to you, then maybe this person just really doesn't have the time or availability or responsiveness to be able to really take on a mentee and give you the type of
attention that you're going to need.
Right. Exactly. So that's something to keep in mind as well. Yeah. So for me, I was fortunate enough to, actually met one of my mentors through one of the events that we hosted at University of Maryland, the Minority Males in Medicine event. And then I actually had the opportunity to wind up working with him clinically. He's an anesthesiologist. And from there, we got involved in research projects, and it just kind of developed from there. And he wound up writing one of my letters of recommendation for residency. So, I think you can't be shy about like reaching out to people. Like these are people who are going to, hopefully help guide you into your future career path. So you definitely don't want to be shy and take the opportunity. And then once you get that opportunity, the things that you can do to be a great mentee is like, one, have specific questions in mind that you want to ask when you're interacting with them to make the interaction valuable for you and for them. So you're not like wasting their time. I think from there, just let the relationship blossom.
Mm-hmm. How important is research for matching into anesthesia?
So I would say, I feel like our field research isn't super important in terms of matching. I think for, at least in terms of the people that I graduated from medical school with, that went into anesthesiology, I think the vast majority of them did not do research. Some of them did present at our national anesthesiology conference, but I think the vast majority of people did not. For me, I'm a very strategic person in the sense of I knew that, from my experience that I talked about previously in gap year, I had some clinical research experience and I enjoy clinical research. And I feel like research is an opportunity to work on something with a mentor where they can have something to talk about for you in terms of a letter of recommendation. So for me, I took a research month, which my school offered. It allowed me extra time to study for step 2 without feeling like it was like crammed in terms of on top of everything else I had during 4th year in terms of wave rotations and like elective rotations, things like that. So it gave me extra time to do that because research has a little more flexibility with your schedule. Also gave me an opportunity to work on something that could be a CV line down the road. And then also opportunity for my mentor to be able to talk about something in the letter of recommendation. So that was like kind of strategic on my end in terms of like accomplishing those 3 things. So that's why I personally decided to do it. But I think that I certainly could have matched without doing research, and a lot of people who go into anesthesiology match without doing research. But I've heard that anesthesiology is getting more competitive. There's going more unmatched spots. So like anything you could do to set yourself apart, I think can be helpful. Unmatched applicants, I'm going to say not unmatched spots, but yeah.
That's good to know. Definitely with the landscape of the more competitive specialties, it seems like everybody has to do research to kind of separate themselves from the pack. In regards to some misconceptions about anesthesiology, what have you heard? What have you encountered? It's something that you can debunk.
First thing I would say, we are not just sitting back there doing Wordle and crossword puzzles as some people think. It was kind of funny because I think it was a couple weeks ago, we had a med student who was rotating through, and they were just kind of like early on. I think they're in the first or second years of medical school, and they were just kind of like trying to feel out anesthesiology. They shadowed different specialties. And we were back there like running all around. I forget what the case was. I'm pretty sure it was a code 1 case. And code 1 means that I believe it's in less than an hour the patient needs to be in the operating room, if I'm not mistaken.
Wow.
So that's a case where it's like a life or death situation. Oh, I remember what the case was now. It was a patient whose basically her limb was like cold. It was unperfused. So she was like had no blood flow. So it was a vascular surgery. So we were rushing around, we were setting up the room as quickly as possible. As soon as the patient got in the room, we were hooking up the monitors, inducing, which just means pushing the medications to induce anesthesia. Intubated the patient, and then we were ready to go as quick as possible so vascular surgery could come in and restore blood flow to this lady's limb. It's very active. Even the times when an anesthesiologist is just in kind of just sitting down or just watching the monitors and things like that, our mind is always going, watching for any subtle changes, seeing like, okay, their heart rate's going up, their blood pressure's going up. Are they in pain? Is something else going on? What is the surgeon doing? Are my monitors hooked up properly? So there's so many things that are constantly going through our head and constantly evaluating the patient and making sure this patient's safe and comfortable throughout their surgery. So yeah, it's definitely hands-on. We do a lot of procedures. We're doing intubations. We're doing central lines, IVs. So it's like not only just an operating room. We call ourselves like perioperative physicians, which means that before a patient even goes to surgery, we need to be in the morning when we see them, or if they come to our prep center, which is preparing patients before surgery. We're evaluating, is this person a good surgical candidate? Do they need other labs or tests before they even go for surgery? What do we need to order for them before they go for surgery? And then obviously I talked about in the operating room, how we care for them. But then after the operating room, making sure the pains are under control, making sure there's no complications from anesthesia. So anesthesia, I feel like, is a little more all-encompassing than people think when they, kind of think of us just back there doing New York Times crosswords. So.
Yeah, and you guys get a little flack about just sitting back there. But like you said, it's a lot more nuanced than that. It's a lot more involved than a lot of people think. You guys are just not sitting back there on your phones. You guys have a lot on your mind.
Right.
So yeah, I definitely appreciate you sharing that. You just discuss what you do as an anesthesiologist about paying attention to details. You're always thinking ahead. What has been that transition from med school actually going into intern year residency? What was that like? How have you been able to adapt your preclinical knowledge to now applying it in real life scenarios?
Yeah. So for me personally, in the field that I went into, being anesthesiology, our transition is a little bit different. So for anesthesiology, you'll do an intern year, and depending on what program you match into, your intern year can look a little different. But for the vast majority of programs, most of your intern year will be internal medicine, maybe some place you'll do a little surgery. So for me, my rotations during intern year were internal medicine, emergency medicine, spent a lot of time in the ICU. I had only 1 month of anesthesia during my intern year, and then some elective rotations. So it's a tough transition. And I think it's a tough transition for anybody, no matter how smart anyone thinks they are or how much people feel not confident in themselves. Because it's one thing to be like, oh, I know enough to answer a question for this test. But it's another thing to be like, I have the confidence to sign this order without anyone else looking at it, and this medicine is going to this patient, or this test or whatever is going to the patient. And, they're going to be affected by whatever order I just signed. So that's a whole different level of confidence. And I feel like for most people, probably 90% of people coming in intern year do not have that level of confidence to be able to do that. And on top of it too, it's they're not expecting you to have that level of confidence. I would always ask my senior residents, what would you consider a bad intern? Because I want to know, okay, how can I stay on top of things and, do a good job? And they would say someone who's overconfident and goes off and just does stuff without consulting me first and talking to the team. So they're really expecting you to ask a lot of questions, and to take time to build that confidence, and they want you to do that. So for me, I was not hesitant about asking questions, even if it was a small thing that I felt like, oh, maybe I should have known this from med school or something. I would still ask because I don't want to make a mistake.
Right.
So
that's real.
I would ask a lot of questions starting off intern year, and over time you get more comfortable and okay, I know I can just order, an Oxy 5 because this person's having breakthrough pain. It's not going to make them apneic and not breathing, depending on, the patient and everything. So I think that takes time. So that was intern year. And then when I transitioned to anesthesia, which is my second year of residency, that's kind of another transition because anesthesia is way more fast paced than I feel like it was than my internal medicine experience, because you're in the heat of the moment, like, giving medicines and doing procedures. And you have to get sharp and quick, because, things in the operating room, things change quickly and you have to react. Like, you don't have time to just sit there forever and just sit and think and discuss and like, oh, let's have a big discussion about why this patient's blood pressure is dropping right now. Like, you don't have time to do all that. You're like, okay, blood pressure dropping. This is my differential, give a medicine and let's go. Like, you don't have time to like mess around. So I feel like that takes time, and it's really, for me, it was like, and a lot of my co-residents, it's overwhelming at first to be able to be operating at that fast pace. And we're worried because it's like, initially, we're either paired up with the senior resident or we're paired up, buddied up, and then the attending is just only in our room. But, after a couple months or so, month and a half, 2 months, like, we're in a room and the attending has another room. So like, they can't just sit and baby us the whole time. Like, so we have to get to a level where it's like, okay, like, I know how to manage some things, and knowing when is like, okay, I need to call my attending now because this is changing rapidly. And I don't want to wait until this is a bad situation and now it's like kind of out of our hands and things are just out of control. So, that's another like big transition. And, even, this year, as I'm getting comfortable doing some of the general OR cases that we do, towards the end of the year, I'm going to do subspecialties like OB anesthesia. I'm going to do next year cardiac anesthesia, SICU, which is our surgical ICU. So that's going to be a whole nother learning curve, dealing with patients in those specialized populations who are, have a lot of complications and illnesses in their own respect. So it's a big transition, but I think the biggest thing is just having a growth mindset at every stage of your journey, having a growth mindset and not being afraid to ask questions, and then putting in the work outside of, whether it be the classroom or outside of the clinical space, to be able to develop that knowledge to be able to do it. So kind of like a short, quick story. We have one attending that we work with who's known for wanting us to be quick, like move fast, like. And I think his whole like reasoning is because like he wants us to be confident in like in our skills and like keep moving. So sometimes, like a lot of times, the attendings will push the medications on inductions, but he'll have us like even early on in our first year of anesthesia, he'll have us push the medications. He was like, stop thinking, like push the medications, like how much you giving, go. Like, and I'm just like, oh shoot, like I need to know off the top of my head like how much like muscle paralytic am I pushing, how much propofol am I pushing, like, and that should be off the top of your head, because that's something we do every single day. So it's whatever you're doing, whatever stage you're at in the journey, you want to have that level of confidence where it's like, okay, off the top of my head, I know, this information and I can like put it into practice.
That's awesome. No, that sounds fun. What do you enjoy the most about anesthesiology?
Honestly, there's so many things. I honestly do like really, really love the specialty, and I'm really happy with my choice. One, like I really love being hands-on. I feel like for me, like intern year when I was on internal medicine, one of the challenges is like, I feel like I was sitting in front of a computer, just typing notes for a large portion of the day, or just like putting in orders. And I feel like it just wasn't really that engaging for me. And honestly, like internal medicine, I feel like I spent a lot less time with patients than I would have thought that I did. So for me, like now being an anesthesia resident, one, I do get to talk to patients. That's another misconception about anesthesia. We do talk to patients, and we do have to have a good bedside manner. People think that we're antisocial and don't want to talk to patients and just want to put them to sleep. That's why we choose our specialty. But for me personally, I love the interaction that I have with a patient before they go for surgery. That's one of your most vulnerable points in time, is when you're meeting somebody and you're trusting them to kind of be your guardian angel, or so to speak, in the operating room and watching over you while you're asleep and don't have any control of your own body and don't have any awareness. And you're trusting this person to take good care of you while you're having a surgery done. So I love the opportunity to instill that confidence in a patient, to know that I'm going to take care of them. I'm going to keep a close eye on them, and I'm going to care for them like it's my own family in the operating room. And then once we get to the operating room, I love the hands-on procedures that we get to do. I really enjoy getting vascular access. I enjoy intubating patients. And then from there, I kind of touched on it, but I enjoy there's times where we have downtime to kind of just sit and like think about the procedures going on, or maybe just like take a look at what other cases we have coming up for the day. But also, reacting quick and giving medications quickly, And, it's very instant gratification. If the patient's blood pressure is low, I give medicine and try to get the blood pressure back up. Or if I think they're in pain, give them medicine, bring down their heart rate. So it's a very fast-paced environment, which I think I really, really enjoy, and really enjoy that hands-on aspect of it. So, and then I enjoy, another thing is that we're involved in so many different aspects of the hospital. So as an example, there's one day I was on rounds with our acute pain team, rounding on patients who we are managing their pain. And we just so happened to be on a floor where there was a rapid response being called because a patient was getting hypotensive. And they looked over us like, hey, like, I know you all are with anesthesia. Can you come help us out? And it's like, we can go from managing a patient's pain to like critically managing a patient who needs to be resuscitated, who may need an airway placed. And that's just, we're kind of like a Swiss Army knife in the hospital, because we can manage pain, we can do airways, we can do resuscitations, we can work in the ICU, we can care for patients in the operating room. So there's like so many things we can do. And I'm not going to lie, it is kind of gratifying when like the team, like you get that call when I'm on call, and I get a call like, hey, like we need an airway in this ICU, whatever. And I just come in, I get to the head of the bed, pop in the breathing tube. Like, you all need help with anything else? You need help with vascular access? Like, we can help you with that. A lot of times they already have a team there, so they're good. But knowing that we have that level of expertise, that when things are really challenging with those, aspects, like they can look to us and be like, hey, like you all are experts in this area. Like, we really need you to step in and like help us out. So I'm really excited. I'm only, I guess, like 4 or 5 months in or so right now of actually doing anesthesia, but I love it, and I'm excited to like continue diving into it.
And this is your PGY 2 year, right?
Exactly. PGY 2 year. Anesthesia, they call it CA 1 year. So
okay.
CA 1 is your first year of anesthesia after you've done your intern year, and then you do a CA 2 and a CA 3 year, which is your last year of residency altogether. And then you go from there.
Okay. What is a typical day like for you as a CA 1? Yeah,
absolutely. So for me, the day actually really starts the night before or the day before. So the day before, we get our room assignments to know, what cases we're going to be doing. So I look up the cases I'm going to be doing. I look up the patient's medical history, looking up if they had anesthesia before, if there was any issues, what they did for their airway. And then looking up, all the different aspects that could affect their anesthesia, like what type of medications they're on, if I need to order anything beforehand. And then from there, once I've kind of developed my plan, I'll reach out to my attending anesthesiologist who I'll be working with the next day. And we usually have a phone call, or we'll meet in person, on our way out the hospital, and talk about what our plan is going to be for the patients that we have the next day. Mm-hmm. And then the day of, it starts pretty early. So that's one thing about anesthesia. You have to get used to waking up pretty early.
Coming in there with surgery.
Yeah, so you're getting there pretty early. So I'm always the first person to the operating room. So I have to get in by, or I try to get in by between like 6 to 6:10. I'm getting to the operating room, and then I'm doing my setup. We have like our a mnemonic that we have to make sure we have everything for our setup, make sure we have our medications, make sure the machine's good to go, making sure whatever we're doing for our airway is ready. And I'll do that until about like 6:45 or so. And then from there, that's when I'll go and actually see the patient, the first patient of the day. I'll consent them for anesthesia. I'll do a brief history, making sure I didn't miss anything from their medical history that might be pertinent. Do a brief exam, and then consent them for anesthesia. Then I'll kind of go check back in with the room, see, when things are going to be ready. And then by 7:30, we'll have the patient back in the room. We'll induce anesthesia, give them the medications, put in a breathing tube, or whatever we're doing for their airway. And then the first case for the day is underway. And then from there, it just depends. Sometimes we're in a case that could be a really long case. So that might be the only case we do for a day. Or we might, fast turnover room where we're doing multiple, like smaller, short cases for the day. And then the day usually ends anywhere from like 3 to like 5 p.m. or so. And then it's kind of repeat for the next day.
It's a pretty comprehensive, jam-packed day, but you get out early.
Yeah, you get out reasonably early.
Yeah.
Like I say, you do have to prep for the next day. And one thing I didn't really touch on is so that's like a typical day. And then we also have days where we're on call. And when you're on call, in addition to doing OR cases, you're also carrying the airway phone. So if there's an airway anywhere in the hospital where a patient needs to be intubated because they're having difficulty breathing, they're calling your phone. So I have to carry that phone, and I have to keep it on, keep the battery charged at all times, because I can get a call from anywhere in the hospital saying, hey, like we have a code blue. So a patient is pulseless and they need an airway for that reason. or patients just have an increased work of breathing. They're not going to be able to sustain their breaths for themselves.
Yeah.
So like, hey, we're going to need you to come and put in an airway. So I'll grab my attending, we'll go up and put in a breathing.
Have you ever ran to a case? You ran down the hallway?
So one piece of advice I got, and this was actually intern year, it's like never run, because actually, I think it was like someone said, what's the first thing you do in a like code? And it was like, check your own pulse. And I think their point was like, you don't want to come in like all frantic and frazzled and like you're messing up because like you're all amped up. I talked to multiple attendees and they said they always walk to a code or to an airway, because you want to be level-headed and calm. And also too, it's like, I feel like it probably wouldn't be a good look if anesthesia's coming running like, oh my gosh, we got to grab this, like freaking out. Like they'd be like, oh gosh, like this isn't good. Like if anesthesia's freaking out, like, and they're supposed to be putting this airway, like this isn't good. So I feel like you need to be kind of calm and, reserved, relaxed. So you can come in with a level head and just like calmly do whatever procedure you need to do. I mean, obviously you want to move with purpose, but you don't want to come in like frantic, because I don't think that's productive for anybody. So I usually don't run. And most people that I've seen, they don't run either. Some people in the hospital, I think people who like aren't used to seeing things like this as much, they get like really amped up and excited and like running and yelling. And I just don't think that's productive. And the codes and like critical situations that are the smoothest are pretty quiet actually, because you can get easy communication. People are intent about what they're doing without creating a whole bunch of extra chaos. Yeah.
That makes sense. I think I know the answer to this question, but I have to ask it. If you could go back again, would you choose anesthesia as your specialty?
Yeah, I absolutely would. Obviously, I'm still early in the field right now. So right now I'm just like super excited to just continue to dive deeper into it and just learn as much as I can. But I think the thing about anesthesia that I like a lot in terms of career longevity is that there's a lot of flexibility in terms of how you practice. So I feel like if there was a point in time where, I was like, I don't think I want to do the big cases and the super critically ill patients anymore. I could cut back and do something like an outpatient surgery center, where I was doing just, more like 7 to 3 Monday through Friday, no weekends, no holidays, and taking care of like less sick patients. And maybe like the cases aren't as interesting, but might fit better into my lifestyle at a certain point in time, which I think is nice. So I think for that reason, I think that anesthesia provides a lot of longevity, and also I think I at least will find a lot of career satisfaction, because I'll be able to tailor it to whatever my lifestyle looks like later on.
Right. What are you looking for the most in your career as an anesthesiologist?
That's a good question. I think that the biggest thing I'm looking forward to is just having the level of confidence in myself and in my skills. Like I said, as an anesthesiologist, you're really an expert in airway management and vascular access. And I think I will have some sense of satisfaction knowing that, if things are difficult, people turn to me and say, okay, we really need your expertise in this area. Like how can we do this surgery? How can I get vascular access? How can we intubate this patient, or whatever it may be? So I'm looking forward to having that level of expertise. And also I'm looking forward to being able to share my knowledge with other aspiring physicians, whether it be medical students or other people that have, pre-meds that I get the opportunity to interact with, be able to share my journey with. So I feel like that's really exciting for me.
I appreciate you diving into your journey from all the way from high school, college, medical school, and now where you're at right now in your CA 1 year. It's been a journey, and it's awesome to see you blossom and grow to this point. I'm looking forward to where your career goes and how you take off in it. Now kind of just transitioning into like modern day, what's going on. You've been around and seeing a lot of the med content influencers, med content creators come up from, Ali Abdaal, Kevin Jubal, and there's new ones like Zach Higley. But recently there's been videos made from these content creators that said that they're walking away from medicine. They're leaving and quitting medicine. Zach Higley just recently announced it maybe 2 weeks ago. And most recently, It's Life by Maggie just announced a couple days ago that she's also leaving. Why do you think these content creators are leaving medicine? And what is this exodus that I'm seeing?
it's because this stuff is hard, bro. Honestly, that's what I think it is. And I think a lot of the people, and I don't know every single one of their journey, but a lot of them, it's during residency or like at the end of residency. And there's like,
Zach was a resident, first year resident.
Yeah, exactly. And, it's particularly during residency. I mean, I think medical school is very intellectually challenging. It's a lot of long hours, but I think residency is like also like very physically demanding because you're switching your schedule. Like you're on, obviously depends on what program you're in, but a lot of places you're doing nights, you're doing days, you're doing 24-hour shifts. You're working weekends, you're working holidays. And I think for these people, like if, they're in that, which is like, it's pretty hard for everybody, but they have an out in terms of financially, then they're like, I'll take the opportunity. Honestly, I think that if that path was a little more clear cut for more people to say, I'll do something else and be financially fine and I wasn't in so much debt, I honestly think a lot more people would take it, to be quite honest with you. Like if it was more like widespread that consulting companies or whoever were coming to, recruiting straight from residency programs, say, hey, like, we'll offer you a job, we'll pay you, this amount of money, you'll be able to pay off your debt pretty quickly in a couple years or so. I honestly know a lot of people who would probably take that opportunity just because of how like, how much work it is. For me personally, I feel like, I put in so much work to get to this point and to be able to care for patients. And I'm truly passionate about medicine and I really, love it. And I want to care for patients clinically, that even if I had an out from that perspective, I don't think I would take it just because, I've worked so hard. Like I want to be able to actually like do it. Like don't want to get all the way here and be like, I'm not going to use it, But I think that those other people, they've found great career paths through other avenues to be able to pursue, where I'm sure all of them are very taken care of financially with how large their viewer base is. So yeah, it's definitely challenging, and it'll definitely test if you really want to do it.
What's your thoughts on the same content creators, not the ones that I listed, but just content creators that build up a following and they're looking at ways to monetize their audience, which are typically pre-med students, college students, high school students, looking to monetize it? Do you think it's okay for them to charge for mentorship and advice, some research courses on how to get into med school? What's your thoughts on that?
That's a good question. I think like, I've heard people kind of share their different perspectives on it. And, I think that, at the end of the day, these people who are offering their time, it's very valuable time. And, so I can understand them feeling like, hey, like, I would like to be compensated for, sharing my knowledge, my expertise of getting to this point. But at the same time, I think that, obviously there's a disparity in terms of, not even in terms of, I feel like over the past few years, it's been talked about a lot in terms of the racial disparity within medicine. But like, once you get to medicine, there's also a huge like socioeconomic disparity of people who are, who are currently in medicine. Even like for both of us, like the process is very expensive, and both of us were fortunate enough to have family support in the sense of like being able to stay at home, where we saved a lot of money as opposed to being out on our own, having to pay for rent and like figure out those things financially. So all those things, like just the cost of the process, I think contributes to the the continued disparity in medicine. I think that for me personally, if I was going to do anything like that, I think there's ways to go about it. I mean, if you create a really strong, YouTube channel where you're giving advice, and if it's solid advice, like, and I don't know exactly how the algorithms work, I feel like you have the ability to really grow your channel, and you're getting a decent amount of money from the views, but also you can get sponsorships and be able to get, compensated for your time in that way. As opposed to creating an additional cost on directly going to the student who's paying for your time, as opposed to having some company, paying for your time in the sense of, a sponsorship deal. So I think that that's kind of how I would go about it, just as to not further contribute to the disparity in medicine.
Yeah, definitely. It's a increased financial burden for a lot of pre-meds to get through the process because the prep courses, the MCAT costs, all of that takes a lot of money, right?
It's expensive.
It's
expensive.
expensive.
And then it's like, that's only if like you're able to go through everything the first time. Like getting into medical school is not easy. Obviously, you can do things to put yourself in a great position and try to get in the first time. But like the MCAT, if you have to take the MCAT again, if you have to apply multiple times, if you have to apply to a large amount of schools just to give yourself a better chance, like all that stuff is really, really expensive.
It all adds up. So if you don't decide to quit medicine after residency, what do you think you will spend your big doctor check on once you finish residency?
Yeah, it's kind of funny because that's a question I ask people a lot, particularly people who are like close to the end of residency and they like just signed on to their job and everything. So, but for me, I think personally, I think that I would like to create some really amazing experiences with my family and a lot of the people who have like really supported me along the path. Like my parents have been extremely supportive and helping me along the journey. So, being able to take a really nice vacation and do something like that to really just like celebrate. Because I do truly feel like, I wouldn't be here without the sacrifices of my parents and some other people along the journey. So I feel like my win and my success of like making it through and becoming an attending anesthesiologist will not only be just my own success, but also the people who really poured into me over the years growing up. So I think that's what I would want to do, like do some type of like nice trip with family. I'm not like a real big like car person, so car like wouldn't really speak to me personally, but and I'll get the point. The other thing is like, once I get there, I kind of need to kind of be a little, I guess, behind to some extent in terms of, starting to buy a home or do things like that. So I'll catch up those things. But in terms of the splurge, I think it's going to be a nice thing to do something with family. But if I had to choose a material item, I have gotten into like looking into watches and stuff more recently. So maybe, and I think a watch should be like a nice like piece to like celebrate that can be passed down to family to celebrate some type of accomplishment. So
sounds like a Rolex.
Yeah, I don't know if I'm going Rollie straight for my first watch, first luxury watch at least, but we'll see.
That's awesome. No, I appreciate you so much coming on today, sharing your background, your journey, and sharing the gems that you have, gained, the wisdom that you have, gained over the years. This is just awesome. Thank you so much. I hope you all enjoyed this interview with Cameran Burt, Dr. Cameran Burt. Please like, subscribe, share this video out with someone that will need to see it and watch it. And remember, it's not a marathon nor a sprint. It's a mission to medicine.
Nice.
Awesome. Woo! How's it feel?